I'm Dr. Van from Animal-Oasis-of-the-Rockies, and today I would like to talk to you about the importance of good dental hygiene and why regular dental cleanings are important. My assistant, Trinity, will be helping you by asking some questions, and I hope we're able to help you understand more about dentistry.
Awesome. Dr. Van, how does dental health impact the overall health of my dog?
Well, recently there have been some newer studies talking about how dental disease is directly correlated to kidney and heart disease in pets, just like it is with people. So it's very important that you get your teeth or your pet's teeth checked.
Okay. How can I care for my dog's teeth at home?
The best way to do it is to brush their teeth. Always using a doggy toothpaste is really important. They can't have human toothpaste. You can use anything. You can do just putting it on their teeth. You can use washcloths. I mean, the best is a toothbrush, but not every dog is going to let someone brush their teeth. Even just putting it on their chew toy that they like to chew on can really help. There's things that you can do like water additives, dental chews, things like that. There's a whole list here at the hospital. So if you ever, want to know what the best recommendations is, you can stop in and we can give you a nice little handout.
Awesome. What are some signs and symptoms of dental disease in dogs?
This is a really important question because I feel like not all dogs show signs of dental disease, meaning it's kind of a silent thing where they are just going to survive. So most oftentimes when they come in to see me, I'll see worse tartar on one side versus the other, telling me that they're chewing on one side. Sometimes you'll notice that they are eating slower, they're dropping their kibble a little bit, they're just not as interested in it. Honestly, once I usually do dental cleanings, the clients then come back to me and tell me how much better their pet feels overall. So I think it's really important that it is something that's more of a silent issue, although there can be, things like dental abscesses that you can see where it's like a swelling, but most oftentimes it's pretty silent.
Okay. What is early detection and diagnosis of dental disease and why is it so important?
So early detection is a big thing we're trying to transition to. Back in the day, we used to say, we only did dentals when they were really, really severe. But now, since we have these newer studies that talk about the correlation between dental health and overall systemic health of your pet, that we're really recommending it at a earlier age. So coming in to see us and getting them in more regularly. I mean, I think the transition is really, we're going to start recommending dental cleanings once a year. Because if you think about it for yourself, right? I mean, ideally we go to the dentist twice a year. I'm guilty of not doing that, but ideally we would, right? But we also brush our teeth twice a day. We floss twice a day. We use mouthwash. Your pet is not doing that. And so really getting them in more frequently for us to assess is really important. And then once they reach a certain age, I'm recommending yearly dental cleanings. I think it's really important.
Okay. How often would you recommend my dog's teeth be checked?
Depends on their age, depends on what kind of dog they are, if they've had a history of dental disease, if they've been totally okay. I think doing an annual exam to kind of reassess that and, kind of say I just did my pet's dental not even 8 months ago, but they are accumulating tartar so fast. Then maybe that patient, I would say once or twice a year versus another patient who, we come in and they don't have any dental disease, they're looking really good. I would just say at their annual, we'll recheck, that kind of thing. So it really depends, but coming in to get that assessed is really important.
Okay. What is a professional dental cleaning like for a dog?
So typically here at this hospital, we do anesthetic dentals. And so it's basically the same thing you do at your dentist. We just put them under general anesthesia for a couple of reasons. One is we are taking off all that bacteria and grossness. And so I want to occlude their airway so that they don't have a risk of aspiration pneumonia. Typically, we monitor everything down to their blood oxygen levels. We scale and polish their teeth, which is really important. So the scaling is what gets that gunk off. And then the polishing is what smooths that surface, which is really important. We take full mouth dental radiographs. And then if any extractions are needed, we usually move forward with that.
Awesome. Well, that was my last question. Thank you so much, Dr. Ann.
You're welcome.